I always approach a heart. Pick up the heart. It should be pointy on one end and sort of wide on the other end. The pointy end is going to be the apex of the heart. The wide end is going to be the base. The base also has, we don't go into it, this sort of fatty ring around it called the coronary groove. But yeah, so the wide end, and if you look at the base, you'll see all the holes, because if the heart's been cut out of the body, all of the vessels coming in and out, are going to be associated with the base. So if you look down at it, you'll see all these sort of open holes. There's one there, one down there. So that's going to be the base. Apex will be the pointy part. If you touch the apex of the heart, you're touching the left ventricle. That's the rule. In terms of the heart, the left ventricle takes up more room than the right ventricle, which makes sense because the left ventricle pumps to the entire body. Right ventricle only has to pump to the lungs. So the left ventricle takes up more of the heart. So if we touch the apex, we know we're touching the left ventricle. The question is, where does the left ventricle end and where does the right ventricle begin? And the answer to that is, if you look at the heart, you'll see, like in this view, you can see this yellow line right here and another line right here. If we follow this line down to the apex, you can see how it just disappears on the apex of the heart. But if we come back and follow this other one, we can see how it dips down towards the apex, but then it bounces back up. So it forms one continuous line that's going to course right around there. This continuous line is going to separate the left ventricle from the right ventricle. So if we touch the apex of the heart right there, we're touching the left ventricle. Left ventricle is going to extend in every direction up to that line. So, if we go up here, this point is going to be where the left ventricle crosses over to the right ventricle. The other way to look at it is if we follow this line right here, all of this smaller area right around here is going to be the right ventricle. So this is all right ventricle right here, this space, and basically everything else, so all of this is all going to be the left ventricle. If you're feeling the heart, sometimes you can get a sense of a sort of a change in consistency, that if you push on this side of the line, which is left ventricle, it's relatively firm. If you push on the other side, it deforms a lot more easily, and that just reflects the wall thickness. So if we open up this right ventricle, you can see the thickness is less than half an inch. So that's going to be right ventricle. The other thing too is if you stick your finger in, you can see how my finger is stopping right at that line. So you can sort of prove to yourself that that really is where the left ventricle and the right ventricles are separated from one another. But I was saying the right ventricle is relatively thin-walled, maybe less than half an inch in the sheep heart. If we flip over now to the to the left ventricle, you can see that it's almost an inch thick, probably 7/8 of an inch on this guy. So that's another way you can tell. But if you're looking at it and you don't have the luxury of looking in the heart, you should always be able to tell regardless, because these grooves are always going to be, they're just interventricular sulci, or interventricular grooves are their technical name. But just look for this yellow line that goes down to the apex and then bounces back up. Just try not to get it confused with this second one. But the second one always stops. It just comes down to the apex, sort of disappears. The other one is always, the one that's important is going to come down to the apex and then bounce back up towards the base of the heart.
And that's the right ventricle.
That's the right versus the left ventricle. And we were talking about on the apex, we see this sort of yellow fatty line up here. That's going to be what separates the ventricles from the atria. The atria are sort of hard to see because they're not really muscular like the ventricles are. They are, but it's just much thinner. So the way I usually find the atria, if you look at the heart, if you look at the base of the heart, you'll see these two little flaps. And the flaps are referred to as the auricles. So there'll be a left auricle and a right auricle. And if we go back, this was all left ventricle right here. So this is going to be the left auricle right there. And then this is the right ventricle right here. So this will be the right auricle right there. The easiest way to find the atria is just to go in through the auricle. So if we look through this left auricle that's been split and sort of open it up, the auricles are all, the atria are always going to be very smooth walled on the inside. So we can see our split left auricle right here, and it just opens up into this relatively small chamber, maybe the size of a walnut, maybe even smaller in this sheep heart.
So
The smooth portion is going to be atrium, and in this case it'll be the left atrium. If we open up down here, we can see the left ventricle right there, and then in between we can see this little flap, and that's going to be the left AV valve right there. So this valve where my finger is going to separate the rougher walled left ventricle from the smoother walled left atrium. And then we have the valve, which is going to prevent flow going from the right ventricle back into, or excuse me, or well, it's basically it's going to prevent flow from the ventricle to the atrium.
So the atria is a smooth sac?
Atria is always going to be smooth, yeah, whereas the ventricles are going to be relatively rough.
A smooth sac or smooth?
Yeah, it's sort of sac. I mean, there's some muscle in there, but it's sort of, it's hard to see it from the outside because there's so many other structures packed in here that when you open it up, it's very easy to tell, where the atria is and where the ventricle is.
Is it going to be like shiny white type color?
Yeah. It should be lighter in color. It should be smooth. Both of them are going to be a little shiny, but I think the atria are maybe a little shinier. Yeah, definitely lighter for sure. So if we flip over to the right ventricle, we'll see roughly the same thing. Looney, I'll pull out the sign-up sheet. I think if it's right there, sign in, but I may have... Okay, I didn't know if I put it away yet. If we flip over now to the right ventricle, this side's a little trashed, but we have the wall of the right ventricle right there. Again, we can see the smoother white interior, which is going to be the right atrium, and then we have remnants of that right AV valve. Sort of by my finger. So the construction is really the same both on the left and right side of the heart. It's just the right heart is going to be smaller. It's going to be a smaller volume in the right ventricle, and the wall thickness is going to be smaller.
So the right atrium goes into the left ventricle?
No.
No?
No. The right atrium is always going to go into the right ventricle. Left atrium will always go into the left ventricle. Okay. If they're crossing, there's something pathologically wrong with the heart. But under normal circumstances, it's always going to go right atrium to the right ventricle, left atrium to the left ventricle. Okay. With an AV valve, or atrioventricular valve between, yeah.
And go over this one.
The interatrial septum.
So interatrial septum. So both the atria and both ventricles, it's important that blood doesn't go from one atrium to the other. It's important that blood doesn't go directly from one ventricle to another. So each set of both ventricles and both atrium will have a significant wall separating them. And the easiest way to find it, it's sort of hard when you're looking at the exterior of the heart. What I usually do is open up one atrium. So this is going to be the right atrium with my pointer finger. And then I'm going to open up and then put my thumb in the left atrium. So now my pointer finger is in the right atrium, my thumb is in the left atrium, and I'm just pinching between. And where I'm pinching, what prevents one finger from passing over is going to be the inner atrial septum. So really when you open up an atrium and you're looking at it, you're looking at the inner atrial septum. Because if I push on this, what happens is my finger will bulge into the other atrium. And so what's preventing it from simply passing through is that partition. Because remember, when we cut this guy open, this is part of the atrium as well. Out here, it's a round structure that we've cut and then opened up.
So that's thick, smooth muscle?
Yeah, yep. It's just, the easiest way is I just put a finger in each atrium and try and squeeze them together, and what prevents them from coming together is going to be the inner atrial septum. And then the exact same is true with the ventricles. It's just much thicker. So if we open up the right ventricle on one side, left ventricle on the other side, squeeze our fingers together, there'll probably be a gap of maybe half an inch between them, and that's going to be the interventricular septum. One of the most common heart defects is it's called a ventricular septal defect, where the interventricular septum, it should close by birth, but in some babies it doesn't close like it should, and so they have a hole between their two ventricles. If it's a big hole, it's a big problem. If it's a little hole, sometimes it'll close up on their own. But it's probably the most common congenital birth defect associated with the heart. And they just call it a VSD for short.
And the heart wall is like the epicardium is the outside?
Yeah, so when you look at the heart in cross-section, technically it has 3 layers. I'm never going to tag the 3 layers. It's really a histologic sort of thing. On the outer surface of the heart is the epicardium, but again, it's only a couple cell layers thick. It's not really anything we can sort of tag by itself. It's sort of like the pleura or the peritoneum. It's just a covering we want you to be aware of. So on the outer surface of the heart is the epicardium. On the inner surface of the heart is the endocardium, again, just a couple of cell layers thick. The majority of the thickness of the cell wall is the contractile portion, and that's the myocardium. So myo just referring to muscle, so it's the muscular portion of the heart wall. The epicardium and the endocardium don't have any contractile properties. They're there just to line, and they serve other functions, whereas the myocardium is what actually is contracting when your heart's beating. So 95% of what we're seeing here is just pure myocardium.
And then the tricuspid valve is the right AV valve.
Yep, it's just another name for the right AV valve. So if we open up the right atrium and the right ventricle, that's going to be, and it's hard because there are these sort of sail-like or, these almost cloth-like structures. You can see some of it right there. Some of it's right there. They're really just flaps between the atrium and the ventricles. And so the valves? So this is the right AV valve or the right atrioventricular valve, also referred to as the tricuspid valve.
Can you show me again? I didn't.
Yeah, it's just these sort of flaps with these little strings attached to them. Mm-hmm. That's going to be the valve, parts of the valve. So that would be the right AV valve. We have the exact same thing on the left side. This one's a little more intact. I can put my finger under there. Again, it's just these sort of cloth-like or flap-like structures. That'll be the left atrioventricular valve, also referred to as the mitral valve, also referred to as the bicuspid valve, depending on who you read and who you talk to.
These terms are so much alike. So did you go over the interratrial?
Yeah, we just talked about it.
Mm-hmm. How about the pulmonary and then the aortic semilunar valve?
Okay, so the aortic valve, if we look on the base of the heart, the structure in the center should be the aorta. And on this guy, we have a hole right here. In that is going to be the aortic valve. I can tell 100% if this is the aorta by simply pushing my finger through. Because remember, the aorta should be flowing out from the left ventricle. So my finger's gone in, so it should come out into the left ventricle. And all I need to do, open up the left ventricle. You can see my fingers right there. So I know this has to be the aorta. Somewhere between where my finger appears and disappears is a smaller version of these valves that we've seen, and that's going to be the aortic valve. It's probably not critical that you dissect it out, but we want you to be aware of it. It's just a smaller version of the AV valves. So that's going to be the aortic valve. On here, it's probably sitting right about there on my finger. If we flip back now, there should be another large hole, which is going to be the pulmonary trunk, which is this guy. And again, I can tell because if I put my finger into it, it should come out into the right ventricle. And we can already see the tip of my fingers right there, which we know is the right ventricle. If we open this guy up, we can actually physically see it in there. So I know that this hole has to be the pulmonary trunk. And what happened is, if there was a couple more centimeters of that, it would have come out and then split into the left and right pulmonary artery. But at this point, all we have is the right ventricle with the single tube coming out of it, which is going to be the pulmonary trunk.
Which one are the...
In the aorta, yeah, it's really in the center of the base of the heart. So this one is going to be the aorta. This one's the pulmonary trunk. But it's hard. If you're just looking at the base of the heart, try and figure out what chamber it's going to. Because if you're only looking at it like this and you don't have a lot of experience, it can be hard. I mean, the other thing you can do, too, so the aorta is going to be closer to the left auricle. So this is the left auricle right there. Actually, you know what? I'm just realizing I'm saying this backwards. Yeah, I would go by the circulation and actually putting your finger in, or I'd make it clear on an exam.
Okay, you want us to stick our finger in and do an exam?
Potentially, if I'm asking to identify a valve or something like that. If it's something I wouldn't want you to touch, I'd have to open it up or somehow make it clear, where it's going. I could put a probe in or something like that and make sure that you could see, where it's coming out or something along those lines.
The pulmonary goes to the right?
Mm-hmm. So the pulmonic valve is going to separate the right ventricle from the pulmonary trunk, and then the aortic valve will the aorta from the left ventricle.
I thought you said the pulmonary valve goes to the left.
No, aortic valve goes to the left ventricle. Pulmonary valve goes to the right ventricle.
And then which one is this one? Is the left?
So this is going to be the right auricle, because this is the right heart. So if we, yeah, this is going to be the right heart here, and this will be the left heart there, and so that'll be the left auricle. The other thing, if you're not sure, is if you just, for this guy, you can open it up so we can see this auricle is opening up into this atrium. This atrium is opening up into the left ventricle, so we know that this whole system has to be the left side of the heart.
And then the chordae tendineae?
Chordae tendineae, when we were talking about, and there's some good examples right here, when we talked about the valve, the valve itself is the sort of flap, but you can see these relatively rigid little strings they're little cords that are connecting the valves to these little bundles of muscles known as papillary muscles. So the little strings are the chordae tendineae. So these are all chordae tendineae right there. These little threads.
You mentioned papillary muscles.
Yeah, so if you look, and they're sometimes harder to see, but the chordae tendineae they should originate off of these little finger-like projections of muscle, which are going to be papillary muscles. Let me just see if this side's any better. Yeah, this one's a little better. So we can see the valve leaflet right here. We can see the little strings, which are the chordae tendineae, and you can see how they're coming off of this little bump that's sticking out of the wall of the ventricle. That's going to be a papillary muscle right there.
So it's only found on the right ventricle.
You can see them in left and right. They're more associated with the chordae tendineae than anything else. So you'll see the wall, you'll see this little lump of muscle, which is the papillary muscle. Coming out of it are going to be the chordae tendineae, and then they should attach to the valve leaflets. So these are all chordae tendineae right there.
Trabecular carne.
Trabecular carne, it's sort of a weird term. It's just referring to, if you look in the ventricles, the ventricle wall is going to be a lot more irregular than we talked about the really smooth atrial wall. Those irregularities associated with the ventricular wall, just referred to as trabecular carne. It's this whole set of little lumps and bumps associated with the left ventricle. It's one of the things it's sort of hard to put a probe on because it's the entire lining of the ventricles. But just think of the sort of lumps and bumps collectively. They're referred to as trabecular carne.